Hello, everyone. I'm Tracy Ariely, end-of-life doula and founder of Comforting Closure. Welcome to a very special episode where we'll explore the intersection of end-of-life care and psychedelic-assisted therapy. Today, I have the immense honor of speaking with Christine Caldwell, a pioneer in the field and the founder of the End-of-Life Psychedelic Care Organization. Together, we're going to talk about the transformative potential of psychedelics in palliative care. Christine, welcome, and thank you so much for being here.
Oh, Tracy, I'm so happy to be here. You know, I love to talk about this subject all day, every day. In fact, I'll probably be talking so fast that your viewers and listeners are going to have to use the button to slow the recording down. So much I want to share, right? I mean, we've
Yes,
already talked a little bit, but so much to talk about.
it's a very fascinating subject. But first, can you start off and tell people a bit about yourself and your journey to establish the End of Life Psychedelic Care Organization, or we'll refer to it now as the EOLPC?
Right? Yeah, that helps. I was thinking about that, and I think actually the genesis would have been in my meditation practice from many, many, many years ago. And from that, you get a sense, anybody who's a meditator understands there's a consciousness beyond, where there's consciousness within, beyond, uniting all of us, right? So when I started to study psychedelics over 3.5 years ago, I really came to believe that psychedelics are a portal into that consciousness. Obviously we can get into that, feel that consciousness through meditation, but psychedelics are a portal into it and maybe accelerate that process. So then when I did start to study the psychedelics, I was drawn to the research relative to psilocybin in cancer patients. And we can probably talk a little bit about that later. Then I went on and I completed the Psychedelics Today Vital Therapies and Integration program, which I greatly recommend. And that was a tremendous learning opportunity. But along the way, I started to also meet end-of-life doulas. And I began to realize the potential for end-of-life doulas to be the facilitators. I mean, I can't think of a better individual to sit with somebody who is toward the end of life. And by the way, the name of their nonprofit is End of Life Psychedelic Care, but I'm really talking about anybody who has received a terminal diagnosis or a life-threatening diagnosis and begins to feel that existential and or psychological distress, right? So all the gamut from early diagnosis phase to really close to end of life. And I usually don't talk about doing psychedelics as you're transitioning because most of us believe that that active dying process is a psychedelic experience, basically, if done right, right? So anyway, yes, I began to understand the potential for an end-of-life doula and anybody who's interested in being a death worker. I don't give you a hospice chaplain, hospice nurse, physician, minister, whatever, that there is such power in those individuals who really understand what end of life looks like and to be able to take care of those clients or patients. So I don't know, it became a no-brainer about a year ago to decide to launch a nonprofit. And I wanted it to be a nonprofit to keep costs low, to offer educational programs. And then I'm just in the process of launching a directory service to connect clients with people I know are trained in both end of life and psychedelic care.
I didn't realize it had only been a year. It seems like you've been around for uh, longer than that because you've been really a big part of the movement. And so I appreciate that. Thank you.
Thank you. It's taken off. I mean, it definitely has taken off. It resonates with so many people across so many different fields, and obviously on the client or patient side, their family, and anybody who wants to work in this field.
When you talk about psychedelics, which ones are you talking about in regard to this end of life care that you're helping with?
Yeah, I generally talk about three because they've been the most widely researched in this field. And then there's a couple of other ones, or at least one other one I'll mention. But psilocybin, clearly, that's where I started. That's where I'll call it the modern era of psychedelic research, really focused. And so I'm talking about the 2000 teens, looking at NYU, UCLA, and Johns Hopkins, all looking at this, typically with cancer patients. And so it's also one of the most gentlest. It's also one that is the most mystical of the three I'm going to talk about. Uh, and it's becoming more available in different states, right? It's already legal in Colorado and Oregon, and many other states are looking at that, and it's decriminalized in a lot of jurisdictions too. So becoming more and more available. Then there's ketamine. Ketamine is legal everywhere. You know, it was approved as an anesthetic in 1970 and used off-label since the 1990s, really, for mental health and chronic pain. And this is where it's so important for people toward the end of life, people in palliative or hospice care, because chronic pain and depression go hand in hand. If you can reduce the chronic pain, you can reduce the depression. You can reduce the depression, you can reduce the chronic pain. So clearly, really, really important. And there's lots of research there that has shown this. And by the way, also shown to reduce the need for opiates following surgery in palliative care patients. So clearly something that people need to look at. Then there's MDMA. MDMA is exciting because we're all hoping it's going to be the first psychedelic approved by the FDA later this year. Now, the research is primarily on PTSD, and there's a lot of reasons for that. But nonetheless, there has been research as it pertains to people toward the end of life. But before MDMA was scheduled as a controlled substance back in 1985, it was used in couples therapy. So there is a research facility, Sunstone Therapies in Rockville, Maryland, who has a study right now with couples where one of the dyads has a cancer diagnosis. The other part of the couple can be a spouse, significant other, adult child, whomever. They undergo the exact same protocol. So it's 3 MDMA sessions plus associated psychotherapy. And the research is not published yet, but there's anecdotal stories coming out that it's phenomenal because MDMA is considered a heart opener, which means it provides self-compassion and other compassion. So as you can imagine, if you're faced with your mortality, you're looking at, can I forgive myself for some of the things I have done? Can I forgive others for some of the things they might have done to me? Can I deepen relationships? So MDMA can really, really, really help you have self-compassion as well as deepen or repair relationships with those that you love. So those 3. And then a fourth one that I'll talk about is 5-MeO-DMT. Now that's a very, very, very intense molecule. By the way, I'm going to say you never use any of these molecules or medicines without a trained facilitator. And 5-MeO-DMT for sure. So very short, very intense journey, but people have called it the God molecule because it puts you right there into unity consciousness. And since its journey is so short, 15, 20 minutes, it can be used really close to the end of life. So we look at, when are these medicines best used? What's the doses, for people toward the end of life? And something like MDMA, because the MA is methamphetamine, right? A little harder on the heart. You may not want to use that medicine closer to the end of life, but more toward when a person was first diagnosed. Psilocybin, pretty gentle. It's used all along, but I know of a couple of people who really look at this 5-MeO toward the end of life. Ketamine also can be used sort of throughout. I think of it as a continuum, as an individual maybe is first diagnosed all the way closer to the end of life.
So within the last 3 to 4 years, there's been a lot more research coming out on the use of psychedelics. Why do you think that right now it's starting to gain so much traction?
Yeah, well, I think when I go back, I mentioned Johns Hopkins and NYU as 2 of the institutions that really started to study this in the 2000 teens, and the results were phenomenal. I mean, just absolutely, probably some of the best results in psilocybin studies across the board, where just a couple of data points. So at Johns Hopkins, fully, it was like 83% of the participants, excuse me, um, reported significant reductions in anxiety, 78% significant reductions in depression, similar results in NYU. But then what was really exciting was that Sunstone Therapies that I had referenced earlier in terms of MDMA also did a psilocybin study. And last year in 2023, they reported initial results were, again, 80% reduction in depression. 67% of the participants reported being in remission. Phenomenal. But even more important, 18 months later, 64% of those people were still reporting significant reductions in depression. 57% of them reported being in remission. And that is a single dose of psilocybin with associated psychotherapy. So again, you don't really see those kinds of results. So I think that's really taken hold, and there is such an interest in, I think, helping people toward the end of life. It's almost like, maybe it's like a low-hanging fruit. And I think the results are really good because people toward the end of life have this openness to wanting to understand what is beyond, to wanting to get over their fear of what is beyond. And so a lot of the success is when people are able to let go. And I love some of the stories I hear where when people get closer to the end of life, it's like, bring it on. I want to see it. And very often they're there. They get that glimpse of the next place, which is a book by Warren Hansen. And he talks about, this next place with awe and wonder. And you get to experience that. So I know I counted 9 psilocybin trials, psilocybin alone, either in the planning stages or underway. So either in the recruiting phase or will be recruiting. And so for anybody who's interested, they should go to clinicaltrials.gov, put in keyword searches like psilocybin, cancer, and they'll get all these studies and to track them, because the field is exploding. And it's not just in psilocybin. There's also LSD. In fact, there's a great study ongoing in Australia, LSD microdosing in patients with cancer, that I'm really anxious to see what those results are going to look like. And of course, we're looking forward to Sunstone Therapies results on this MDMA trial that I was talking about with the couples. So yeah, it's exploding. Well, ketamine for that matter as well. I love the fact that the Michael J. Fox Foundation donated $2 million to Yale to study depression in Parkinson's patients. So, there is a lot going on in the field, is just continuing to blossom, I think, as a result of it.
What does a typical psychedelic therapy session look like in the context of palliative care, or not even palliative care, just in general? Okay.
Yeah, there probably is no typical session beyond the fact that there's always the coming up phase, the on-ramp, there's always the trip, right? And then there's always sort of the off-ramp or the coming down. And that depends, the length of each is depending on the ketamine, right? Ketamine's 5-MeO is the shortest journey, 15, 20 minutes. Ketamine can be 45 minutes to an hour. Psilocybin can be 4 to 6. MDMA can be about 6 to 8, whatever, 4 to 8, depending on dose. So, but a lot depends on the person's intention. And a lot depends. Sometimes we say the medicine's going to show you what it wants to show you, maybe not what you anticipated. So that there's people who do have more spiritual experiences. There's many people who report confronting their cancer. One of the things about psilocybin is, generally speaking, it brings issues front and center. So people often report confronting their cancer, talking to their cancer, getting a sense of coming to terms with their cancer. And there's a great story the gentleman from Canada who was one of the first Canadians to receive psilocybin therapy through a special access program with Health Canada, and who has now undergone 7 psilocybin journeys. So he had a conversation with his cancer and he asked it, "Why are you here? I don't want you to be here." And the cancer's response was, "Do you think I want to be here? I also don't want to be here." And he calls his cancer almost me. And he understands that it's consciousness as much as you and I are consciousness, as much as anything else in the universe is consciousness. And he's really come to understand that our physical bodies are just a physical body, that our essence is much more than that. And that's what psilocybin has done for him.
With therapy assisted sessions, I know that usually you have a couple sessions before you have, before you actually go through the actual therapy or the actual using the medication, and then after to integrate. Can you explain that to our listeners?
Yeah, I love this question. Typically, yes, everybody that goes through psychedelic training, we're taught preparation, the journey, and the integration. And I'm really coming to believe we're talking about a way of life, not 3 different segments, right? And this is another reason why I like to work with anybody who's in an end of life related field, because now I think we should look at the totality of the individual. So as you come in and you begin to get to know the individual, you get to know, well, how do they handle anxiety? How do they handle conflict? What do they think of death and dying? What are their fears, right? So you really get to know that person and you become a trusted confidant. As I said a little bit ago, one of the best predictors of success, I'm going to say, is a person's ability to let go. Typically, you cannot let go until you absolutely trust that facilitator, that person who's going to be sitting with you. So that part is so important. So then part of this preparation also is, well, let's talk about what this journey is going to look like. So you understand, but let's also really practice ways to calm yourself if you need to, which is going to include breathing techniques, mantras, maybe some somatic techniques where you're getting into your body, some other sort of a simple yoga technique. And you practice with this with the individual so that when they go into a journey, they already know which one best serves them. What serves you and I, say, as a breathing technique may not serve your client. What serves us as a mantra may not serve your client. So you need to take the time to get to know them and then to have them decide what is the best for them. So that's sort of, okay, we'll call that the preparation. But you take that into the journey, right? And this person now has an ability to self-soothe or to calm themselves. But the other really, really important thing is that you, as the facilitator, now have an ability to attune. We use the word attune, which really has become intuitive to your client's needs. You also, by the way, need to practice all the things I just talked about. You need to center yourself. You need to ground yourself. You need to be there and present for your client. But now you have this sense. It's shared energetics now between you and your client. That makes for a successful journey, I think. So now, yes, we'll come to the after. And the after, again, when we're talking about an individual toward the end of life, is pretty much until the end of life, right? You just don't do, yeah, typically it's like 2 integration sessions and you're off you go. It's like, no, you're there for the duration. And so you talk to that person, things will just keep coming up. And by the way, we talk in terms of people have these insights. People sometimes do, but people sometimes don't. And so what's really important was for you to have listened up front to say, yeah, you know what? I really feel guilty about something I did to my sister when I was 12 years old. All right, now let's fast forward and let's talk about that. Let's talk about, has that shifted? Has anything shifted with that? Can we talk about talking with your sister? So you're there for the duration, and I absolutely love that. The other big, big, big thing that's really important that's not usually talked about is the family. So, as you know, as a doula, the family dynamics is so important. So, not only do you have the normal dynamics that you would deal with, but now you've got, oh, what's going to happen to my loved one? They're going on a psychedelic journey, right? And yeah, and often that person's going to come out different. They may want to take back control of their life, right? Sometimes their family members don't want that to happen. So it's you have to educate the family up front what's going to happen to their loved one. And by the way, you can decide, your client, you and your client and the family member can decide, I'm going to participate in one of these journeys, just like with the MDMA couples therapy, right? Yeah, I'm going to participate. That's got to be a buy-in from everybody, right? And then at a minimum, it could be, well, maybe not minimum, but maybe I'll just be in the room, right? And if my loved one wants me, I'm there as well. Or they don't participate, but then during this integration phase, you're definitely going to be talking with them. There's a great story where a doula that I work with a lot, Mary, um, she will make family members leave the room if they're agitating the client. And I don't mean during the journey, I just mean in general, right? And she has this great story where she closes the door, but on the outside of the door, she posts a meditation. And she says, before you enter this room, you have to go ground yourself. So, it's all of that. So there's a lot of similarities between a younger person undergoing a psychedelic journey and a person faced sort of with their mortality.
When a person is working with a doula, is it just a doula, or does a therapist, a doctor, have to be involved also?
Oh, yes. Thank you. Thank you. Thank you for reminding me. All right. So a collaborative team is so important, right? And this is where also then as you get to know the client and you have a sense at least where they are from a physical health standpoint, always get a medical team on board. Now, you might not always get your client's medical team on board, but there are people, there are professionals who will help consult. And I always, always, always talk about the spirit pharmacist, Dr. Ben Malcolm, who is a board certified psychiatric pharmacist and will do consults for drug interactions and health considerations. So, available. For any of your viewers or listeners who want more information, they'll have my contact information and I'd be happy to provide it. There's medical doctors who do psychedelic medical consults. So always take advantage of that. And by the way, all of us as facilitators have to decide what we're comfortable with. There are people who are very, very, very experienced who are willing to work with somebody really close to the end of life. And there's some other facilitators who are not. You get to decide where you feel most comfortable. And so do you always need a psychotherapist? Not necessarily. Would it be great to have one on the team? Yes. I will also say, generally speaking, this may be controversial, but this goes hand in hand with the Oregon non-medical model, where during the actual journey, you may not need a psychotherapist. Maybe you do after for the integration part. So yes, have that team. Also know your client well enough to go, they'd like a minister or a chaplain or a rabbi to participate in the journey. So there's just, you think about the network of support, and that includes before, during, and after, right? So there's a physician, a palliative care physician I'm working with who is doing at-home ketamine therapy. And by the way, we've got a small pilot going where we're using a doula to help prepare to sit during the journey and then to support the individual after. So I'm so excited about that because part of what I want to do is, I'll say, legitimize, the role of a doula in this whole thing. And again, whether it's a doula or chaplain or nurse, physician. But anyway, my point is that some of the patients he works with are very close to end of life. So yeah, In this case, as a patient, you might decide you really do want to have a physician on board. And for ketamine, by the way, since it is a Schedule III substance, you do need a prescriber like a physician or a nurse practitioner to actually administer. In this case, we're talking about an intramuscular injection in the home to give a really deep journey. So all of that, this is why I say education is so important, because people don't know everything I've just shared with you. People don't know that they have those options, those choices, and it is their choice, right? It is their absolute choice as to decide what to do.
So I have a question. So where can people find a person who is trained so that they feel safe? They know they're getting someone who they'll be safe with, but also from a perspective of being a doula or any other death care worker. Um, Two questions on that kind of front. But how do they get trained to make sure that they can help and do it correctly? But also, do you believe that a person that is helping, is giving this type of assisted therapy, do they need to go through the process first? So I guess it's a three-parter. Where can people find someone who has been trained correctly? How do people get trained correctly? And do they need to go through the experience first to be the best they can at doing this?
Yeah, I'm usually not somebody who says must or never or ever have to. And so would I recommend that it's better that anybody who's going to be a facilitator have undergone psychedelic journeys? Definitely. Does that mean you have to undergo all of them? I just talked about 4 different substances. So, maybe not necessarily, but I think understanding what an altered state of consciousness can be like is really valuable. So if you only feel comfortable with a ketamine, a legal molecule, great. If you're willing to do psilocybin or MDMA or 5-MeO, great. But I do think it is better. Right, so that's that. In terms of where to find, that's a really good question. So ketamine, of course, being legal everywhere, then the decision becomes, okay, do I want to go into a clinic? Am I capable of going into a clinic? Do I need to have support at home? And that takes 2 forms. I just mentioned the physician, the palliative care physician in California who goes into the home. Then there's also telemedicine, so at-home ketamine options. And so they're very different. If you go into a clinic, then you have to make sure you get what you need. I mean, I hear these horror stories. For example, there was a gentleman, I forget if it was cancer he had or not, but he was toward the end of life. And he had an at-home session, and then he wasn't able to have a second at-home ketamine session. He went into a clinic, and they did not allow him to have anybody sit with him. He wanted his wife to sit with him. If somebody wants their spouse, a loved one, another loved one, or a doula or a chaplain to sit with them, you got to make sure that that's allowed in the clinic that you want to go to. Um, so that's important. And need to get them educated, say, on telemedicine. And along those lines, I offer free webinars on a constant basis to the public. So anybody can sign up for them on my website. So there's that. Psilocybin, if people choose, there's Oregon where it's legal, there's Colorado where it's legal. There are so many jurisdictions now in California, in Massachusetts, in Michigan, where psilocybin is decriminalized. So basically, that doesn't mean it's legal, but it means that it's the lowest priority for law enforcement. So the chances are nobody's going to care. There's also churches. So there are psilocybin churches. You operate in a kind of a legal gray area. Pretty much, well, where the feds could come in, pretty much the feds have not. They kind of they kind of stand back and threaten, but they haven't. So there are psilocybin churches. One of the ones that I work with is Sanctuary, and that's Sanctuary with a PS. So I would recommend people looking them up as well. All right. So where to find, really where to find. So there are some directories out there that have psychedelic therapists or coaches that have gone through trainings listed. I'm actually in the process of building a membership directory now, like I mentioned up front, where I know people are trained in both end of life and psychedelic care. The public-facing directory won't be ready until June because I'm trying to get the professional side. So if anybody out there wants to join on the professional side now, please do, because then we will launch it to the consumer side in June. And I'm going to actually do consumer outreach. So it's not going to be a static directory. So there is that. I think too, I always tell people, this is irrespective of whether you're toward the end of life, but I always tell people to look up their local psychedelic society. There are psychedelic societies all over the country. And of course, if you're in Canada, you can have your physician help draft an application to Health Canada. So, but that's separate. So I think that covered it. Did that cover all three of
Yes,
your questions?
it covered it. So going through this type of therapy, there are a lot of misconceptions. I think the biggest one is that a person might just have a bad trip uh, and it's unsafe. What are some of the misconceptions that you've heard and that you run into all the time? And considering that big one of people being afraid that they're just going to go off the deep end, how does the medical establishment actually put in some kind of rails, side rails, to make sure that that doesn't happen?
Well, okay, that's a really great question. And, I guess in terms of the medical establishment, they're in the process of developing protocols now. I mean, this is a new field. And so when you talk about the medical establishment, they proceed slowly, they proceed cautiously, right? And they're in that process. So that's really great. And of course, as we talked earlier, lots more research being done now in the fields to really inform that process. But then you get to where people are practicing it. And I go back to what I said before, which is make sure there's a team in place where you have medical clearance from a medical professional, where you might have a psychotherapist on standby. Um, and so you take those precautions. I think generally speaking, though, when I talk about preparation, that is so key because we don't necessarily know what the psychedelics are going to uncover. They probe deep into a person's psyche, right? And sometimes it's stuff that you've buried, and sometimes it's stuff you really want to stay buried, but we don't know. The psychedelics sometimes brings it out. So being able to resource yourself, meaning calm yourself if you start to get into a very anxious or panic state, is really, really, really important. Having that mantra, having that breathing technique, having whatever it is that can calm you. All right, that's that. But I think that in terms of myths and conceptions, people are afraid they're going to lose their mind or they're going to lose control of their mind. Now, if we're talking about somebody toward the end of life, let's say somebody who's just been given a cancer diagnosis, you already feel like you just lost control of your life. So this may be the last thing they really want to consider. And this is where you come back to this very trusted confidant as your facilitator, that you're going to help them understand they're coming back. One doula told me once, it's like, yes, I always tell a person, you've just bought a round trip airplane ticket. You're going, but you're coming back. So don't worry. We'll talk about that. If something comes up during the session, part of what we'll talk about is you are coming back. We'll talk about a safe word. In fact, somebody else uses the word safe. And if they see that their client is started to get agitated during their journey, safe. You're safe. So there's a lot that can do that. You can go a long ways to help your client. There's also medications that are contraindications. It's really important to know, but there's some myths that are beginning to be busted. For the clinical trials, they ruled out almost any antidepressant, SSRIs for sure. But that was primarily because they didn't want any confounding factors, right? They wanted to see if it was the psilocybin that was in fact doing the work, not some other antidepressant. Well, when you get into some real world scenarios, and we have a big basis now of real world scenarios, yeah, you know what? SSRIs can blunt the subjective effects. So people say, yeah, I didn't have this really fabulous journey. But you know what? That doesn't correlate to them actually not getting the therapeutic benefits. So really important that we're learning a lot of this, as we go along outside of the medical establishment. Now, there's some other things people absolutely have to know, that there's other contraindications, and this is where you might need somebody like Dr. Ben Malcolm to help. Lithium, for example, prescribed for a lot of severely depressed patients. Lithium, a total no-no on psilocybin, can increase the risk of seizures. Lithium for ketamine enhances the subjective effects. And similarly, by the way, SSRIs, for one form of ketamine, you have to have a prescription for an SSRI. So you've got that going on. I think another myth is that one and done and you're cured. First of all, it's not a cure, first of all, and second of all, it's not a one and done. You have to go into it understanding that I'm going to open myself up to the possibility, and we'll see what happens. Now, I do want to mention, since you kind of alluded to this when you asked the question, there is HPPD, hallucinogen persisting perception disorder, where people do actually have flashbacks to the journey, some benign, some frightening. And it's been reported in surveys of about 1 to 4% of the people do experience HPPD for some period of time, most of the time resolving itself within 48 hours or 2 weeks. However, sometimes not. But 1 to 4%, and actually, the majority of those were on LSD. And I'm talking about I'm talking about recreational users. So under a therapeutic protocol, no, we don't see that. Under a guide that is trained, we don't necessarily see that. But I think you need to put it into context, and it's the probability is very, very, very low.
I've talked about with a lot of people on the show how expensive it is in our country to be sick and to die. It's sometimes it's a rich person's game, right? And especially with therapies like this that aren't covered by insurance, but are really needed. What does a person, who doesn't have the money, doesn't have the finances, how can they get this type of help?
Yeah, another great question. People do have to realize that many of the options are private pay, and that includes ketamine, although legal, is typically not paid for, not reimbursed, except maybe for chronic pain situations. And then any chronic pain dose, I will say, also then handles anxiety and depression. So if you can get that reimbursed, great. There is that one form of ketamine called S-ketamine. Spravato is the name, where many insurances do reimburse for that. So that may be an option. In the state of Oregon, and I think you'll find the same thing will happen in Colorado, each licensed service center has to have a social equity program. So that means they have to be able to offer their services to folks who can't afford it. I don't know all the regulations around that. I can tell you though that my son, who has very little money, was given an opportunity for a psilocybin journey. I am eternally grateful to that facilitator. So there is that. And then the other thing that we're just like, go, MAPS, the Multidisciplinary Association of Psychedelic Sciences, which none of us would probably be here if it wasn't for them, because they are the ones responsible for getting MDMA to the finish line here with the FDA. So they're hard at work at getting reimbursement for psychedelics. And there's clearly cost models that show there's a cost savings. And so we've got to continue to work on that. But, counting on social equity models is really important, I guess, for the short term. And yeah, it's Yeah, well, that's a whole other subject, and it's a tough one.
It is a really tough one, because it's very far reaching and uh, really kind of disturbing, quite honestly. But and so um, if I'm a person that is in another state and I go to Oregon, are there any? Do I need to be a resident of Oregon to be able to participate? Do you know?
Nope.
Okay.
Do not need to be a resident. And I am starting to build a really good network of whether they're doulas or licensed therapists who are now uh, licensed facilitators in the state of Oregon who have worked with end of life. And yeah, so generally speaking, you can contact a licensed service center. In fact, I'll put a plug for Omnia Group in Ashland because I visited there when I was out in Oregon. Lovely Michelle and Brian Lindley, just beautiful people who are hiring facilitators that have end of life experience. So you're not going to find that all over, but then there's doulas I know in Portland who are trained facilitators in the state of Oregon who can do this work. I know people in Bend, Oregon as well. So, it is growing. And so I'd be happy to help any of your listeners find somebody in Colorado too. Excuse me, I wanted to say in Colorado too because there is the retreat going on. I had mentioned before we started to film that there is a retreat going on right now uh, with women with cancer with a trained license, in this case, a licensed social worker, psychedelic trained. And so psilocybin is legal in Colorado now. You just can't buy or sell it, but everybody gets around it.
Yeah. How many states is this legal in? If it's, I think it's a very small list. So if you could name them, um, and where is there decriminalization that's coming on the books? Like I know in California, I think it's supposed to be decriminalized by 2027, I think, but don't quote me on that. Maybe if you know, great, let me know.
Okay, well, this is what I know. So Oregon and Colorado for sure. And then there's either pending legislation or ballot initiatives in California, in Massachusetts. I'm gonna look at my cheat sheet here, in New Jersey, and several other states that we should know within a year as to whether or not that legislation or by November, whether the ballot initiatives will pass. And then there's 16 other states that I counted that have some type of legislation. And by that, I mean funding research. Typically, a state dips their toe in the water by saying, let's fund psychedelic research, and then look to the potential for building a regulatory framework. And it can take several different forms. Like Oregon and Colorado, those are non-medical models. Other states like California and I think Massachusetts, or it was in New Jersey, are looking at medical models. So yes, but it's obviously starting to open up. And then in terms of decriminalization, I kind of mentioned that Washington, D.C., psilocybin is decriminalized. And then in Michigan, Massachusetts, I think even Maine, California, the state of Washington, there are cities where psilocybin is decriminalized.
Which
So
I think is so interesting. I live in San Jose. I could go to Oakland or in I think in Santa Cruz also.
Santa Cruz.
Yes,
Yep.
and I know one of the churches is in Oakland. I think it's the Church of Ambrosia that's up in Oregon. Sorry, up in Oakland, and they have helped with that also.
Exactly. That's why, yes, there's the churches. Um, and it's interesting, but you go back to your question earlier about how do people find out? And I'm still, that I guess that's one of my main goals is to continue to educate people on what they can do. Are they good for you? Maybe they're not good for you. Maybe yeah, maybe they're not good for you. But nonetheless, to educate people and then to help them find um, trained facilitators.
And also to really normalize that conversation because there's such a taboo around it. And we know people are using it outside of the therapeutic benefits, but I think it's that normalizing of that conversation. We don't talk about death, we don't talk about aging, we don't talk about drugs, we don't, so it's those conversations that we need to have.
It really is, and it's not just around psychedelics, right? Uh, because by the way, when I first launched the nonprofit, my mission was reduce existential and psychological distress. And it's like, wow, it is just so much more. We want to shift the narrative. We want to shift the whole approach towards death and dying, right? And so, yes, and so we see death cafes, we see death over dinner meetings where people are really beginning to normalize the conversation around death. Well, to me, this is just another layer of being able to talk about it. And so it's not just therapeutic, right? We talked about this coming to terms with consciousness, getting a glimpse of the other side. You want to think about it that way. That is so important. And maybe, yes, along the way, you lose your fear of dying and you do reduce your anxiety and depression and anything else, but this whole other world opens up to you. So, yeah, normalizing that, that's a great way of thinking about it.
So what role does EOLPC play in advocating changes in policy? I'm going to do that over. What role does the ELLPC play in advocating for changes in policy regarding the use of psychedelics? Um, and what are some of the other things that EOLPC does?
Um, all right, so I started out first pillar for me since I did launch last May is education. So, and that takes a lot of different forms. So, whether that is speaking at conferences, um, I spoke at the Florida Conference on Aging last year. And so then that's an audience of clinicians, which is really great. So, educating clinicians, I spoke to the MD Anderson Oncology Center. So, informing them about the potential of psychedelics and then hospice agencies, speaking to hospice agencies. So that's sort of the beginning, right? And then, of course, in addition to, as I said earlier, consumers, as well as any professional who is working or wants to work in an end of life related field. So then to move beyond that, I do want to get more involved in advocacy. I talked with somebody at the federal level who then would love to take some of this research forward on Capitol Hill. And I'm just really excited to try to get involved at that level. And so whether it's me personally or whether it's somebody else that I know that works in this field, it's like, yes, we have to get it to Capitol Hill. We have to get it to federal agencies. We have to get it more front and center with some of the state legislative bodies. Because, by the way, we have right to try laws on the books, and right to try allows anybody with a life-threatening or serious illness, sometimes maybe with a prognosis of a year or less to live, to get access to an investigational experiential drug, one that's been through at least one phase 1 clinical trial. Well, psilocybin, however, though, got excluded from that list. And so, there is lawsuits underway to try and get the DEA to reschedule psilocybin just from Schedule 1 into Schedule 2 to allow a physician to prescribe it for an individual toward the end of life. And there's also federal legislation, the Breakthrough Therapies Act, that's really important. So, again, maybe not me personally helping to do the advocacy, but knowing about it, helping to spread the word so that anybody out there who's really interested in writing their congressman or congresswoman about the Breakthrough Therapies Act, have at it. And then let's see what else. Well, I guess it's just continuing um, to educate. And then for me, then the next pillar is connect. So to be able to connect clients with, as I said, individuals trained in end of life and psychedelic care. And then the sort of third pillar has been to begin to build these pilot systems or other systems to bring the care directly to a client. So the small pilot we're doing in the state of California is just the beginning. So the palliative care physician there will work with the patients and the end-of-life doula. And then I want to take that and expand on it and write grants around that and be able to bring that to other states. That's ketamine. And then talking to licensed service center like the one in Oregon, the Omnia Group in Ashland, to be able to build a custom retreat for individuals toward the end of life. So these individuals obviously are still able to travel, but they can bring their family members if they so choose. They can bring their doula if they so choose, and then take advantage of psilocybin retreats under the regulation, the umbrella of Oregon, or for that matter, in Colorado. So yeah, sort of those three pillars is what I'm setting out to do.
Do you ever look, because we've talking about the United States, do you ever look at countries outside of the United States to see how it's done well and what we could bring back here, what we can learn from that?
Yeah, so Canada is probably right there at the top of the list because they do have, first, they have medical aid in dying available across, it's a national health system, right? So through Health Canada, you still have to jump through several hoops and, of course, have physician, not just approval, but the process is pretty set in stone. And I don't know exactly how that is versus what we have here in the States, where we have maybe 11 states where medical aid in dying is available. So across the board. And the other thing that Canada is looking at is if an individual gets approved for medical aid in dying, they are automatically approved for psilocybin. That's a model we should look at. And then also in Canada, as part of that approval process for psilocybin therapy, a patient who is approved has basically two choices. They can either work one-on-one with a trained therapist, and TheraPsil is probably the best well-known psychedelic training facility in the state of Canada. I mean, in Canada. Or there's group therapy models. And one of the best well-known group therapy models is Roots to Thrive out of British Columbia. And so that's a model that we should seriously look at in the States because it brings that cost down, right? And people really, really benefit. Thomas, the same Canadian I referenced earlier, talks in terms of bonding with a group of people in the same situation. So people who are faced with their death and dying, being able to prepare together, being able to journey together. He eloquently speaks about, it's not, this journey isn't just about me, it's about all of us on this journey. Because for some of us, you think about being in a group situation, you might, on a journey. I mean, personally, I don't think I want to be in the same room with anybody else undergoing a journey. I just really want to be in my own head, right? And then afterwards, their integration is so much better because they get to share, again, because they're in the same boat, right? And so it all becomes just amplified. I mean, he just speaks in terms of it's helped him immensely. So yeah, so that group therapy, medical aid in dying is important. Across the rest of the world, well, no, it's not happening. I mean, it's really unfortunate when I think of how some of the other countries. I mean, look at Britain. Britain is in the forefront of psychedelic research, and yet they're not able to really bring this forward to anybody, really, except ketamine.
Interesting. So, how can people support you and the EOLPC?
Yeah, come to my website since it is eolpc.org. And of course, I take donations for me to do this work, especially to maintain the free webinars. And as I said before, I do a lot of the introductory webinars all the time. But what I also do is bring together experts, and I do panels, I do conversations with experts. So people experienced in psychedelic therapy, especially as it relates to end of life. And I've already got two more ideas I just really, really want to bring forward. And then the other thing that I want to launch this year too would be online discussion group sessions, right? For people with a terminal or life-threatening illness. Because again, from listening to Thomas speak, how important that is. And actually, I don't even care if the person is undergoing or wants to undergo a psychedelic journey, to have an ability to have somebody to talk to and maybe open your mind to the possibility of a psychedelic journey is really important. So yes, to be able to offer that, and I want to offer that at no cost, but of course you have to pay the facilitators, have to pay for the infrastructure to do that. So yes, thank you for that. But in addition, just in general, the classes are there. There's classes for the professionals. I have one coming up I'm really excited about. I don't know, it's March 28th. I don't know if this will be out there in time for that, but what I do it's a course set, 6 modules where I talk about a range of psychedelic factors or topics, all with a lens to end of life. We also do an end of life doula training, as we say, with a plant medicine component, but that is a standard end of life doula training program for anybody who wants to be a death worker. So not necessarily a doula in the strictest sense of the term, but if you want to work in the end of life related field. So yeah, thank you for letting me kind of go on about that.
And I know that those two courses repeat themselves a lot. So it's not just
Right.
one and done. You have them throughout the year. So, you know, people can continually look on your site and see when the next course
When
begins.
the next courses are. Yeah, and I do deep dives in other things. Like we're going to do one on spirituality. We're going to do one on bereavement. I want to do a deep dive on ketamine because it is legal. So, yeah, it's that kind of stuff. So it's not just also, one program. It's like, yeah, there's so much. This field, as you know, this field is so wide open, so rich in ways we can help people.
Well, Christine, we are at the end of our time together, and I wanted to thank you so much for being on the show and for sharing all of your wisdom. Thank you.
I thank you, Tracy, and yeah, for the opportunity and for the work that you do as well. So yeah, onward, upward and onward. Yes.
Folks, as we wrap up today's conversation, it's evident that navigating our or our loved ones' final stages of life brings its unique set of challenges and decisions. Today's discussion with Christine Caldwell has opened our eyes to the innovative world of psychedelic assisted therapy as a viable, compassionate option for those seeking peace and understanding in the face of terminal illness. Thank you for joining us. If you've any questions or thoughts, please don't hesitate to comment below or reach out to me directly. And if you've found this conversation enlightening, I encourage you to like, share, comment, and subscribe. Your support helps spread awareness and comfort to those navigating the complexities of end-of-life care. This is Tracy Ariely from Comforting Closure, sending you off with wishes of peace and comfort on your journey. Until next time, take care.